Hi everybody. This is Dr. Garima Verma, also known as Dr. Scrubs on Instagram. So, today we have with us my best friend and my UG batchmate and everything, my bro, Dr. Surbhi Jain, who is currently
And
pursuing DNB Ophthalmology from Mohan Eye Institute Delhi. So, hi Surbhi, how are you?
hi, I'm good. How are you?
I'm fine, I'm perfectly fine.
I'm
So,
to refer to you as तो बीच में तो
huh?
ठीक है?
क्या सॉरी
Do that. I'm going to refer to you as bro in between थोड़ा
yeah
because
yeah
I'm used to it.
it will work. Thank you for taking out time from your busy schedule for all of us for this session mainly. So tell us a little bit about your life, a little bit, how's life and how is residency treating you?
So loaded question. Life is good.
Okay.
ठीक है? Residency is also good. There are good days and bad days.
Correct.
Sometimes there are too few good days and a lot of bad days.
Correct.
But overall can't complain. Life is good.
Yeah, so good days and bad days are part and parcel of life. Like we talk on daily basis and we're like, bro, आज ये हो गया. So, what does a day in your life looks like, and like the work that you do in hospital, and when do you get free, when do you report, and everything we want to know about your life, professional life.
So typical day, professional life. Typical day is like I wake up at 6 in the morning.
Yeah.
ठीक है? I get ready, all that jazz. Travel to work.
Mm.
Reach around 8 o'clock in the hospital.
Yeah.
If I have to go to the OT, then I change into my scrubs and I set up the table. I think about all the surgeries that we're going to do. I prepare everything. Then the chief surgeon comes in. We do the surgeries around 11, 12, 11 o'clock, 12 o'clock, we get free. Then we go to the OPD, we see the patients. So basically, what we as residents do is a basic workup. So in Opthal, that's like, first of all, very chief complaints, history. We take the vision, we do the torchlight examination, the slit lamp examination. We do any investigations that we feel might help in the case according to our differentials.
Yeah.
And then we show the patient to the senior doctors.
Okay.
And accordingly, if we find something interesting, we discuss about it, or we note it down to read it later on. Then lunchtime comes. So if you have OT the next day also, if you're supposed to assist in the OT next day, then you have to prepare the OT list and prepare ahead in general. Otherwise, you can do lunch stuff. ठीक है, lunch खाओ, chill मारो, catch up on your messages. Then again OPD starts at 3
Okay.
and back to work. Then I come back home around 7 to 8 and same cycle, dinner, sleep, repeat.
So, why did you choose this branch and the college or the hospital that you are studying? Especially, why did you choose Optha? Why did you choose DNB Optha over MD Optha?
Okay. So first let's tackle the branch thing.
Okay.
So as you know,
this is
surgery
a
was my
this is a
branch
long
of choice.
story.
ये तो मतलब 15-20 मिनट के इंटरव्यू में हम नहीं कवर कर सकते, तो बहुत बड़ी चीज. But the basic gist is surgery was my first love.
Yeah.
ठीक है? Surgery is my first love. ठीक है? I'm still doing surgery.
Yes.
So that's exciting. The main factor that made me choose Opthal was because it is a surgical branch and I'll get a lot of hands-on and it has always been the surgeon life for me.
Yeah.
So I'm really happy that I'm pursuing it,
Yes.
honestly. Uh, it's also really terrifying because Opthal surgeries have a really, really steep learning curve.
Correct.
And baby, as I'm 6 months in my residency, so I've started like doing a little bit. Baby steps and बहुत baby steps हैं, obviously because it's really, really tough, but
Yes.
it's so amazing. It's really
It's
amazing.
thrilling.
It's thrilling, yeah, exactly. So, as for DNB, the main reason is because when you're doing Opthal, first of all, you have to think after 3 years, will you be a capable cataract surgeon or not?
Correct.
Because 90% cases that you'll do as an ophthal person is cataract. It's
correct.
bread and butter.
Yeah.
ठीक है मतलब it's gotten to a point where you see a old patient in the OPD and your and they say कि भाई कम दिख रहा है हमें इतने टाइम से कम दिख रहा है and your first thinking is कि भाई cataract है dilate करो ठीक है so that's the main reason and so in ophthal you have to think about this stuff in any surgical branch I think in any branch actually you have to think about the amount of patient load that you will be seeing
Correct.
the amount of exposure that you will be getting
Yes.
okay the amount of city the kind of city that you will be living in okay that has to be a factor
Correct.
so I chose DNB Ophthalmology because DNB में एक तो in my institute there is a lot of exposure
Correct.
I'll be a capable all my seniors are capable cataract surgeon they've gotten at least 200
Wow.
surgeries under their belt ठीक है so in their residency
Wow.
so
This is something amazing.
yeah so that was the main deciding factor actually because that's the main thing you have to think in optal other than that first of all up to MD MS DNB it's all equivalent
Correct.
and so you don't really have to think कि DNB अगर तुम ले रहे हो तो it's like a fallback option it's not a fallback option it's among the top of your list it should be among the top of your main concern while you're choosing a branch or a college should be what you'll be doing in the next 3 years
Correct.
not what the people will think about you
Correct.
what your degree will say about you ऐसा कुछ
Agreed. So the branch general surgery to opthal.
So even in my counseling my first choice was general surgery
Yes.
this was really below on my list of options when you fill out that counseling list so but when I was doing MBBS also the hopeless romantic in me was like nahi surgery nahi milegi to kuch aur nahi kar sakte aise tha
Yes.
but the practical part of me always used to think ki surgery to hai obviously first option but second option was opthal even
yes then also your second alternate option was always opthal I remember.
alternate was always opthal even you tried to convince me also na ki opthal ही रहना चाहिए first option
yes I remember.
तो नहीं तो मतलब what I meant to say is कि first love तो surgery है but love can happen twice
correct.
and you go to an ophthal surgery theater you see retinal surgeries being done you do a fundus examination also bhai jo feeling आती है ना when you focus your first retina that feeling you must remember मैंने ब्रो टेक्स्ट किया था ब्रो मेरे को मजा आ गया आज मैंने रेटिना फोकस किया है
I remember.
that thing that you see it's like falling in love it's really like falling in love
Okay.
it's beautiful
So how is the transition from MBBS to MD like MBBS level pe to we don't do this stuff na we just only dilate and do the torchlight examination that too we don't remember seeing any stuff so how is the transition from MBBS to MD in ophthalmology basically.
So in ophthal it's being particularly challenging because again as you said ophthal में उतना exposure नहीं होता है हमें even vision we are not recording on a daily basis तो वही सीखने में भाई मुझे तो लग गया था 1-1.5 महीना I was so bad in the beginning I even now I think that the amount of silly mistakes that I used to do even now I must be doing but I'll realize it in 6 months or a year or so. So, but everybody is really patient because even they know कि MBBS में there is not much exposure. So that's about particular. But in general, transition from MBBS to residency, it's like in MBBS तो तुम बच्चे होते हो क्या बोलते हैं उसको कि कच्ची मिट्टी होती है तुम्हारी ठीक है but in residency you are like responsible for everything ठीक है you are the pillar you are responsible अगर एक प्रिंटर भी खराब होता है ना तो तुम्हें बोला जाएगा कि खराब हुआ है
correct So residents are basically the foundation of a hospital, I think. They keep the hospital running, basically. That's what I feel. And I have been talking to so many residents, and everybody has this same statement that we are the foundation of a hospital or a college, that we keep the hospital running, because everything, like first year resident तो is supposed to do everything in that particular hospital. मतलब अगर सिक्योरिटी गार्ड भी नहीं होगा तो यू शुड लॉक अप.
चाय ले आओ सामने से.
So
ठीक है.
okay.
एंड इवन ये तो है ही. एंड अदर देन दैट कि जैसे लेट्स टेक माय एग्जांपल. मेरे इंस्टीट्यूट में एटलीस्ट 4 to 5 ये होते हैं जो स्पेशलाइजेशन, जैसे एक रेटिना सर्जरी, रेटिना की स्पेशलिस्ट है मैम, एक कॉर्निया स्पेशलिस्ट है, देन अदर इज अ ग्लोकोमा स्पेशलिस्ट. तो मतलब they have their own patients that they see in the institute, and then they expect you to follow up on that patient and inform them about it.
That is how
So
you learn, right?
that's how you learn, huh?
Yes.
So you're supposed to make everyone's life easier.
Correct.
And life gets really hard in these 3 years. मतलब मेरे तो 6 ही महीने हुए हैं, but I've heard. ठीक है. So but you it's again इतना मजा आता है कि गुड डेज और बैड डेज में बैड डेज सहने की हिम्मत आ जाती है.
Correct. So I think this should be the mindset before entering the residency, that there will be bad days, but when good days can what I should say, like what is that word, that when good days are there, then just bad days को झेलने की हिम्मत आ जाती है, like that, right? So
मतलब बैड डेज आर गोइंग टू बी रियली बैड. ठीक है. यू विल फील लाइक अ लूजर, यू विल फील लाइक यू आर नॉट वर्थ एनीथिंग. में भी हो सकता है, इतना बैड भी हो सकता है every day, बट फिर इतना गुड भी होता है कि एक तुमने एक सर्जरी करी है और कोई पेशेंट तुम्हें आके बोल रहा है कि डॉक्टर साहब नजर एकदम ठीक हो गई है. दैट फीलिंग इज
correct. So are you happy with the choice that you made, and if given an option to change your branch, would you do that right now?
I'm definitely happy.
Yes.
ठीक है. I'm happy about my choice and I'm happy about my residency.
Correct.
And if given a choice to change, okay, so if I would definitely change.
Okay.
First thing. Second thing is, it would be really childish of me to change because let me explain. So what happens is, we are doing MBBS and we have a dream कि मुझे ये ब्रांच करनी है, मुझे जैसे मेरा था, मुझे सर्जन बनना है. That's a मतलब एक होता है ना कि सपना देख रहे हैं, डे ड्रीम है बस.
Okay.
तुम्हें कुछ पता नहीं. You don't know the kind of people you'll meet. You don't know what challenges you'll face. You don't know what you like and what you want. You just know कि हाँ एक चीज है वो करनी है.
Yes.
तो if I leave now, it would definitely only be because things are getting too real, yaar. Things are getting too real. I'm responsible for way many things, and you know it's all too real. The struggle is too much. तो इसीलिए maybe I feel like कि हाँ अगर मैं छोड़ दूँ कुछ और कर लूँ, maybe it will be easier. That would be wishful thinking on my part.
No, that is just a daydreaming kind of situation, because surgical residencies are tough. That's what I have heard. And surgical residencies include OBG, surgery, Opthal, ENT, and like so many things now. So yeah, I have heard this from residents that surgical residencies are tough because of the steep learning curve. Correct. So what do you have to say about MD versus DNB, and whether someone should prefer branch or college?
So as I said, MD, MS, DNB, it's all equal now.
Okay.
So तो बात को तो दिमाग से निकाल दो. It took me a long time to get that out of my head. So I can understand where anybody is coming from if they think that way. But as a person who's into this degree now, I'll say कि हाँ, it's equal. वैसे भी in general perception it's equal, and it's equal in your perception also when you start doing residency.
Okay.
So, as for branch and college, I think it's a really specific thing. You have to factor in a lot of things.
Yes.
But one thing that I'll say is that people don't really factor in when they're making the choice. As doctors, we tend to be really, passionate and just going for it kind of people. कि
Correct.
कुछ नहीं सोचना, बस जो है वो है, जो सपना
Yes.
देखा है वो पूरा करने वाली बात है.
Correct.
But what you should definitely factor in is that these 3 years are going to be really, really hard. You're not going to be able to do it if you have a lot of regrets in your mind and if you don't have that peace of mind. Okay? So you should factor in stuff like, what is going to make me happier? Where am I going to be more settled? That kind of thing when you're thinking about the college. As for branch, I think the counseling sort of decides that for you
Correct.
eventually.
Like somebody should have alternate options. Like some.
Should have alternate
Yes,
options.
because
You should not just choose one branch and be like,
yes,
यही करना है.
yes,
You should go with the flow. सब अच्छा होगा, ठीक है. जो भी तुम choose करते हो, that will yield good results if
yes.
you do good in that area.
Correct.
And just don't get stuck up on things like नहीं ये तो मेरा यही करना था, अगर मुझे तो अगर मैं ये नहीं कर रहा हूँ या नहीं कर रही हूँ तो मेरी लाइफ का कोई मीनिंग नहीं है, ऐसा कुछ. Don't get stuck up on that. ठीक है, life's too long to be thinking about these things.
Yes.
And when you get into your residency, you will realize कि there's such a long road ahead कि वो तो बहुत ही minor decision था जो अभी तक लिया है.
Correct. 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 So, do you get any time for yourself, especially in first year? And is there any toxicity in your department?
Toxicity, okay. So first of all, I do get time for myself, but as you know, मेरे को आदत है 3-4 चीजें फैला के रखने की वाली. So I have a couple of things that I need to be doing and I don't do any of them. I start and I don't do any of them. So मतलब चीजें होती है in residency. You have to do a thesis also. If you're making any presentations, you have to work on them also. If you've seen something interesting, you want to read about that.
Correct.
If you're doing a particular case, if you're assisting in a particular case tomorrow, then you want to be, able to read. You have time to read all that.
Yes.
Then Netflix पे रोज कोई ना कोई नई series आ रही होती है, तो you want time to see those also. So मतलब it depends. If I manage my time better, I can get time for myself. But as of now, तो नहीं मिलता है उतना time.
So you're first year resident only, na? So, and as for toxicity in your department, is there any toxicity?
So actually, my institute is kind of a small institute. It's
Okay.
like a tight-knit family of people. So it's good overall. Everybody takes care of you.
Hmm.
Otherwise, in general, ophthalm में इतनी toxicity I have never come across.
Okay.
All the consultants are very, chill, and they just want to have a chat with you, make
Okay.
you understand something.
Okay.
They're like that. So I can't say about other branches, but yeah, in general, I don't think if you see, मतलब एक दो ही होते हैं, वही बात है.
Yeah.
ठीक है. हाँ, तो वो एक दो से you can either fixate on those toxic elements or you can, enjoy your life.
Correct.
Think about the good things.
It's all about perspective and mindset.
It's all about perspective.
So, do you have any specific tips for somebody who is waiting for counseling or mindset before residency and anything that you want to add?
जो भी लोग काउंसलिंग के लिए वेट कर रहे हैं, for specifically for them, just because I regret wasting my time moping around waiting for the counseling, I want to say कि just do whatever you thought you would do after the exam.
Correct.
Don't worry about you have to get ahead, so you need to start preparing again. या फिर you need to start preparing for your residency. There's no such a thing like preparing for your residency. ठीक है? You learn on the job. Don't worry about that. So just enjoy as much as you can. जो बोल रहा है कि तैयारी करनी चाहिए, कुछ करना चाहिए, उसको ignore करो. ठीक है? They don't know anything. Just enjoy as much as you can. You're not going to get this time back. You're not responsible for anything. You don't have to look forward to anything. You don't have to look backward at anything. You just have to be in the moment and enjoy.
Correct.
Just have fun.
Okay. So, my last question is, when you were preparing for NEET, who was your favorite faculty and why?
So I followed Marrow
Yes.
completely. 100%. My favorite faculty, I think I loved all of the teachers of Marrow,
Yes, they
but
are amazing.
you remember, I was totally fangirling internship mein, I was totally fangirling over Dr. Rakesh, how he teaches medicine,
Yes, he is
and
amazing, amazing. Like I love Dr. Rakesh's medicine.
just the, just the passion that
Yes,
seeps into his videos, na?
yes,
Even when
yes,
he's teaching medicine, he's teaching you a lot about life
yes,
also.
yes,
And Dr. Rohan definitely,
definitely.
his trip videos and photographs were highlights of like कि हाँ इतना भी कर सकते हैं, इतना fun भी कर
Correct,
सकते
correct,
हैं,
correct.
surgeon fun. That kind of validation I got from him. And Dr. Sakshi and everyone was just amazing. Marrow is an amazing source for preparing, and any source, in fact, that you stick to is amazing to prepare. You just have to, focus on what works the best for you.
Okay. So, any specific things you want to add, subtract, or anything, or something more about your institute you want to share? Anything?
Uh, Not specifically about my institute, but my branch actually. Uh, it's more of a validation point for me
Hmm.
that I didn't used to. I was kind of against doing anything else other than surgery, and I know most people are in that mindset. They have a dream branch, and they're kind of against doing anything other than that.
Hmm.
No, in their mind they've built up ki this is the thing and there's nothing else other than that. So I want to say, as a person who's been on the both sides of it, uh, it's give yourself a chance,
Yes.
listen to your instincts and give yourself a chance to fall in love again.
Correct. Correct.
Just
Correct, correct. Exactly. So it was lovely talking to you, and thank you for your
thank,
time. Thank you for your time, and thank you
thank,
for being truly unfiltered for this interview. Like, I was not expecting this unfiltered interview, but yes, it was truly
practically
unfiltered.
this is actually as an introvert I would like to say कि मेरी social battery यहाँ पे खत्म हो गई बस.
So,
I'm going to sleep now.
so thank you so much. Thank you so much for your
Thank you for
time.
having me.
Thank you. Thank you.
And also एक चीज और मैं बोलना चाहती हूँ,
Please,
sorry.
please.
You said your thank yous and everything, sorry I'm adding this,
No,
but
no.
uh, it's kind of what I want to say is I'm really proud of you and what
Thank you.
you're doing
Thank you so
and
much.
how far you've come.
How far we
And
have come. How far we have come.
but I'm being proud of you right now. Okay, let me be proud of you for this. So
Thank you.
I'm really proud of you,
Thank
and
you.
I'm really sorry if I'm not able to follow your content in that much depth as I would like
Yes.
to. But it's kind of traumatizing for me. मुझसे नहीं सुना जाता काउंसलिंग की बातें दोबारा से. But yeah, I'm really really proud of you and what you're
Thank you.
doing and how you're sharing your experience with everyone. It's amazing. You're a warrior.
Thank you. Thank you. Thank you. Now I'll catch you up on WhatsApp. Okay, I'll take your leave now. Thank you, bro.
Okay. Bye.
Bye.